Good afternoon and welcome to the Insurance Subcommittee of the House Health Committee. I'm happy that everyone is here today, and given that we need to adjust some schedules, we have 4 bills that we're going to be talking about today. We have 45 minutes to complete our work. If we do it less than that, we'll get kudos from the chair. We're going to take the bills in this order. We're going to start with House Bill 393. We're going to go next to House Bill 445. Then we will go to House Bill 494 and end with House Bill 442. So, Lisa, we're going to go with House Bill 393, Health Insurance, Scout Cooling Systems, Required Coverage. Can you tell us what the bill does?
This bill requires carriers that provide coverage for chemotherapy to treat cancer to provide coverage for scalp cooling systems used for the preservation of hair in connection with the chemotherapy treatment, and there are no amendments.
Okay. Delegate Congolo, thank you for being here.
Yes.
Can you talk just for a minute about your bill, why you were bringing this to us?
Why am I bringing this to you? Well, I guess I'll just be frank. I had a constituent reach out to me. This was just shortly before last session, and she is still undergoing chemotherapy. And she told me about scalp cooling. I knew nothing about it, never heard of it. And I just kind of went down a rabbit hole. And the more I talked to other women who share their stories with me, I'm a mental health therapist by trade. I don't know if you all know that, but it was just really seeing how losing your hair leads to so much mental distress. And just hearing those stories, and the stories just became more and more. I just started to hear it more, on a regular basis. And a lot of the women said they would rather preserve their own hair than to wear a prosthetic wig, which is covered by insurance. So I don't have any personal connection to it, but that was, I don't know how to really, I've never done a subcommittee meeting, so forgive me.
Move the bill.
You're doing a great job, Delegate. Thank you very
Okay.
much. Before
Oh, is she frozen?
Okay, Delegate Chair Collison just got stuck.
I let Delegate Kipke move the bill, ask if seeing no electric hand, you
I
got
second
stuck,
the bill.
Delegate?
I second the bill.
Oh, okay. All right, so Delegate Kipke moves and Delegate Tavera seconds the favorable report on House Bill 393. Is there any further discussion?
I'm curious why they don't, they were, I mean, if anybody knows the cost of wigs,
Madam
it's
Chair.
comparable.
Um,
Why they wouldn't approve it. So I'm like, that's crazy.
I understand Delegate Tavares, but we've moved it. It's good. Is there any further discussion? Seeing none, all those in favor, please say aye.
Aye.
Is there any opposition? Hearing none, the bill passes unanimously. Thank you very much, Delegate, for being here.
Thank you, and God bless you all.
Yeah,
All right.
I
Thank
just wanted
you.
to say I was here, Madam Chair. I made it.
Thank you, Delegate Kaufman, but I'm still, is it okay for me to hold you to the end?
That's fine.
Since
I just
gave the
wanted to let
bill
you know
order?
I came.
Okay, thank you. So we're going to move to House Bill 445, Medical Assistance Program and Health Insurance Coverage for Orthoses and Prosthesis. It's the so everybody can move, Act Part 2. Is Delegate Martinez here?
I am, Madam Chair.
Okay, great. Well, let me go to Lisa first. And Lisa, tell us a little bit about the bill.
This bill alters the current mandated benefit for coverage of orthopedic braces to be coverage for orthosis and replacement of orthosis, and clarifies mandated coverage. There is an amendment, and the amendment alters the definition of orthosis to include devices used to treat congenital conditions.
Okay. Delegate Martinez, are you comfortable with this amendment?
I am, yes. It's a amendment that will then mirror the bill to the Senate version that has moved out of Senate Finance favorably.
Okay, do you feel the need to say any more about the bill, or are you comfortable with what we know about it now?
I'm very comfortable, and I appreciate all of your support.
Okay, thank you very much. Is there anyone who would like to move the amendment?
Move the amendment.
Second,
Okay, Delegate Johnson and Delegate Taveras. It's been moved and seconded. Any discussion on the amendment? Seeing none, those in favor, please say aye.
aye.
Any opposition? Hearing none, the amendment passes unanimously. Do I have a motion on the bill?
Move the
Move the
bill
bill.
as amended.
Okay, I've got Delegate Taveras moving the bill. I've got Delegate Johnson seconding. And I've got a question from Delegate Morgan.
Thank you, Madam Chair. I'm just looking at the fiscal note of this and just trying to wrap my head. How does this not have a fiscal note if they're covering orthopedic braces?
Delegate Martinez, do you want to take that or I can, either one?
I can take a stab, and if I miss anything, please add where I might fall through. But under you looking at the utilization of states similar to ours, such as New Mexico, it is not a huge utilization, particularly for the activity-specific orthesis. And so this bill doesn't have an impact. Also, the coverage for this is already mandated. And so we're just updating our statute to make sure that folks are getting the coverage they need. And so that's my understanding of why there isn't a physical impact to the state. And also, we were able to drill down the codes necessary with advocates and the department to make sure that we are accurately identifying what the cost would be. Whereas before, there was a huge carte blanche of different Medicaid codes put into the bill to calculate costs that were not reflective of the actual, on the ground realities.
Okay, all right. I appreciate that. Thank you.
Any follow-up, Delegate Morgan? Are you good?
I'm good.
Okay. Anyone else who would like to speak to the bill?
I do have a brief question on the small business effect. It does say that it might be meaningful, and why would that be? Given that they're being paid.
My assumption is that it's a positive effect because it's going to be covered by more sufficiently covered by Medicaid than would need to be by the individuals.
Okay, so I just misread. All right, thank you.
It's not always negative when it says there's an effect or an impact. Sometimes, most of the time it is, but it's not always. Any other further discussion on the bill? It's been moved and seconded. All those in favor, please say aye.
Aye.
Please say aye. All those in favor? Okay.
Aye.
Anyone
Aye.
opposed to the bill? Anyone opposed to the bill? Okay, the bill as amended passes unanimously. All right, we're going to bill number 3, which is House Bill 494, Health Insurance, Primary Care Investment Targets, Reimbursement and Reporting. I don't believe, I don't believe Chair Bagnall is here. If she is, please let me know. But Lisa, you want to go ahead? Tell us what it does.
This bill requires individual, group, or blanket health insurance policy or contract delivered or issued for delivery in the state by insurers, nonprofit health service plans, and health maintenance organizations to provide reimbursement to healthcare providers in a manner that meets the annual primary care investment targets established by the state on or after February 1st, 2026. When filing a premium rate or premium rate change with the insurance commissioner, a carrier must submit a description of the carrier's progress in the meeting the annual primary care investment targets.
Okay, and I want to make clear that the targets have not been set yet. And there's an understanding that, and we have a couple of people here from the Maryland Insurance Administration who can make sure that I'm telling the truth, that no payer will be held responsible for anything until the standards are known. So, and this is all part of aligning ourselves with the goals of the AHEAD model. So, Mary Quay, did you want to add anything, or Jamie Sexton? Jamie, you're okay? Oh,
Yes,
there
ma'am.
you
I see
go.
that Mary unmuted, and I will always defer to Mary.
Okay.
Jamie, there is no reason for you to defer to me, but yes, this is something that the MIA is very interested in, and we are prepared to work to enforce the bill once the standards are set. And I believe that, well, no.
Hello? Delegate Cullison?
Mary, can you try now? I think we're
Yes. Chair
my
Cullison?
okay. Mary, you want to talk about this bill from the MIA's perspective? There we go.
Sorry, problem unmuting. Yes, the MIA is supportive of the concept of the bill and moving forward with the AHEAD model. And we look forward to working on the setting of the targets, and we'll work to enforce them once they have been set. And if David or Jamie
Let me
has
ask the
something I've
question.
forgotten.
Let me ask the question.
You're cutting out, Madam Chair. And
I should have made my desire for flexibility with our technological challenges. Mary, can you unmute? Okay. I don't know if you heard my question, but is there an intention for the MIA to, and I'm assuming MDH, to work with the carriers to set the targets?
Yes, we will be working with the MDH. I believe it's MHIC and HSCRC on the targets.
So will the carriers have any ability to provide input?
Yes, I anticipate we will be hearing from stakeholders along the way. We always try to work in a transparent manner and to get input from the affected parties.
Okay, great. Thank you. All right, so are there any other questions on this bill? This on House Bill 494?
If not, move favorable.
Okay, looks like I have, so I have a motion. Do I have a second?
Second.
Okay, let's stay in. Second is Pam. Okay. Any further discussion on this bill? Okay, then those in favor, please say aye.
Aye.
Anyone opposed to the bill? Okay, seeing none, passes unanimously. And we will move to the last bill for our work session today, House Bill 442, Professional Liability Insurance Coverage, Nursing Homes, Assisted Living Facilities, and Nurse Midwives. Lisa, tell us about it.
This bill requires each nursing home assisted living program and nurse midwife to provide notification if professional liability insurance coverage is not maintained or such coverage has lapsed or not been renewed. Each nursing home assisted living program and nurse midwife that does not maintain professional liability insurance coverage must post the notice or the information in a conspicuous location. There is an amendment, and the amendment would apply the requirements and the provision to licensed certified midwives.
Okay. Delegate Kaufman, are you comfortable with that amendment?
I'm absolutely comfortable. The amendments just conform it to the Senate bill, and it had no opposition and no fiscal note.
Okay, thank you. Are there any other questions on the bill?
And it passed Senate Finance already.
Move
Okay.
the amendments.
I've got a movement on the amendments. Do I have a second?
Second.
I'm sorry, who is that?
Pam.
Yep, okay. Sorry, Delegate Gazzoni. And is there any opposition to the amendment? Seeing none, it passes unanimously. Now the bill is amended. Do I have
Move
a
as amended.
motion? Okay. Do I have a second?
Second.
Okay, it's been moved and seconded. Any further discussion on House Bill 442? Seeing none, all those in favor of House 442 as amended, please say aye or raise your hands. Okay. Any other, will there be anybody opposed to the bill as amended? Okay, seeing none, bill passes unanimously, and we have completed the work before us in the subcommittee. Is there anyone? So we get those kudos from the chair. Anyone who has something that they need to say at this point, or we will be adjourned. Okay, seeing no hands go up. Thank you all. Thanks for being here. And these bills will work their way through the committee probably this week. And have a great